Okay, so for this module, we're going to be doing a uterine artery embolization on the Mentis simulator. This is used for treating fibroids. It could also be used for treating postpartum hemorrhage in patients that are bleeding. So it's a useful procedure for those in low to middle income countries to learn using here our simulator. So for the first step, again, we're going to introduce a 5 French-based catheter. For the first portion of this, I'm going to use a C2 catheter. It's a Cobra 2 catheter and a normal 035 wire. So we do have right groin access with a 5 French sheath. I'm going to introduce the catheter and the wire now through that access. And you're going to see it come up on our screen. Okay, so we're going to fluoro. We have the catheter up. We're going to go up with the wire. Now we're going to get above the bifurcation for the right and left internal iliac, right and left common iliac arteries. We're going to pull back down till we're over the bifurcation. I'm going to send the wire down so we go down the contralateral leg. Okay, and what we're going to do now is we're going to ride the catheter over. And we're going to immediately, because we're trying to find the internal iliac artery where the uterine comes off on that side. And you can see the robust arterial supply to the uterus there on injection. So we're going to get down into that internal and come down a little bit farther into it. We're just going to come a little bit farther down until we get right to the area of interest, which is going to be right where the uterine artery is. All right, so maybe we'll do an injection from here. What I'm going to do is I'm going to do obliquity. And on this side, we're going to do an LAO, see if that opens up anything. Let's fluoro right there. And let's do a DSA now. And there you can see a nice injection. You can see the uterine artery coming off as that first arterial branch. Again, supplying the uterus there. So at this point, we're going to pause and we're going to switch over to microcatheter. So now we're going to introduce our microcatheter. Again, this is a smaller catheter that fits within the base catheter. This one's usually somewhere between 2 to 3 French size. This one will be a 2.4. And what we're going to use here is a micro wire. And that's an 014 wire. It's a very thin wire, very small and very soft tip that we're going to use. We're going to go ahead and introduce that to the microcatheter, into the base catheter. So you introduce that until it's picked up by the machine. There you can see it sees the wire. We're going to get the microcatheter there shortly. Now you see it sees both. So now we're going to come out and we're going to try to go ahead and select the uterine artery. And let's see where this is going. It looks like it's going out laterally. A little injection. And that's in the uterine artery branch. So what we're going to do is we're going to go ahead and track out even more distal into this uterine artery. So we're going to get our wire out even farther, our microcatheter even farther. And I'm even going to bring our 5 French catheter a little bit farther out to give us some support. So we're going to go ahead and get out. And we're going to get to this kind of lateral branch that goes out within the uterine artery. So we're going to pull back the wire. I'm going to show you that right now. We're going to go back to AP. All right. We'll do a little injection to show you guys. And right now, we're in that uterine artery. There's a little bit of a downgoing branch, and that's actually the cervical vaginal branch. So what we want to do is we want to get past that. So we don't want to be in that branch that goes down. So we want to get a little bit past that. So what we're going to do is we're going to get a microcatheter just a little bit more distal. We're going to bring back our wire and we're going to do our injection again. And now you can see that we're just injecting and we're only seeing the uterine artery and the uterus there with the fibroids in them. This is a good point for us to stop before embolization. So for this portion, we're going to now deliver the embolic agent. Again, we're going to deliver it either through the microcatheter, and I've already selected the embospheres, which are particles in the size range of 5 to 700. So I go ahead, I'm going to do this under fluoroscopy, and you're going to see me injecting right there, and you can see it all going towards the fibroid uterus. We're going to continue to embolize. And what we're trying to go for is near stasis, so either static within that branch for 5 heartbeats, or stasis. So now you can see that we're getting pretty sluggish flow here. So we're going to let it settle out. And you can see that's getting very, very slow. You're going to start seeing staining of the fibroid uterus soon. So there you can see a little bit of staining of the fibroid uterus. I'm going to give a little bit more here and just see if it goes forward. Very, very slow to go forward, right? And if we count it out, 1, 2, 3, 4, 5, I still see it persistent in that uterine artery. So that's a good endpoint for us to stop the embolization on this side. Okay, so for this step, what we're going to do is we're going to get the wire through the catheter, and again we have the Robert's uterine catheter here that we're going to use to form a loop to bring to the other side. So what we're going to do is we're going to get this wire up to the midpoint, and then what we're going to do is we're going to push and twist up, and that will form that loop in that catheter. And you can see it here. Let me follow this so you can see it. And what you're going to do is you're going to see me come down with this big loop into the ipsilateral leg. So we're going to come down, push it back up. We'll come down with a wire first, maybe, on this one, and the ipsilateral leg. And we'll pull down here. We'll bring it right around where we think the internal should come off, on the ipsilateral side. And we're going to do a little injection here just to prove it. There we are. I'm going to turn the catheter just so we're facing the other way so that we can pull into that ipsilateral. Push up just a little bit, and right here is where the ipsilateral comes off. We'll get a catheter in there, and then we'll get a wire down there, and we'll pull down into this. So we'll pull everything down over the wire, right there, and that gets us right into where we want to be. That wire is probably selected in the uterine, but what we'll do is we'll come out and we'll do an injection. We'll come out with the wire, and we'll do a quick injection and just see where we are. Yep, so we're in the internal outside. That gives us a nice injection there and showing us that other part of the uterus that we need to embolize. I'm going to do a different oblique now. So we'll do an RAO oblique. And then we'll do a run right here. So we're going to do a DSA. Holding this down, we'll do an injection. We get a nice picture there showing us where the uterine comes off. So now for the next part, we're going to be using the microcatheter. Okay, so for this next part, we have the microcatheter here. Again, this is a smaller catheter that fits within our base catheter. It's usually somewhere between 2 and 2.8 French, so this is going to be 2.4 French that we're going to use. And also we're going to be using an 014 wire, a very small wire that allows us to select those small branches that we're going for. I'm going to introduce this into our base catheter just to get started. Now you see it's going into our base catheter. We're going to use this to select the uterine artery that we want. Okay, so now it recognizes both. We're going to put the 2E switch on here to hold things in place. Now I'm going to fluoro so you can see it. So now you see the wire coming out of the microcatheter and the base catheter. We're going to get everything down. This looks like it's in a good position. Let's see what we're in right now. Let's do a little injection here. We're going to pull our wire back and do a little injection. And note, we can see that we're in a branch that goes down to the lateral aspect of the pelvis. So that's not what we want. So let's see if we can find something else. It's more fitting with the uterine. Let's see. A little injection. You can see that it comes off right where we're right at that branch point right there. So we're just going to come off just a little bit. Now it should come off laterally here, based on what we see on the angio. So we're going to try to select it again, manipulating the microcatheter and the micro wire. We get to something slightly different position. What we'll do is we'll maybe change some of the characteristics of the wire or the catheter in order to give us a little bit better position there. So we'll try a slightly different angle here. And that might give us a little bit better position to get into this branch. We'll push down a little bit. So we're injecting here and see where we are. Back down, and there we go. And now we're in a branch that looks a little bit more like it's going in the right direction. We'll do a little injection here. Nope, that's a lateral sacral, so we'll come back. We'll try to find something different. Here we go. So we're just before it, and we're going to come back a little bit. And right there, it's engaging in the vessel that we want. We'll get that there, and then we'll bring the microcatheter to follow. There we are. Let's see where we are now. We'll do a little injection here again to see. Yep, and we're in the uterine branch. You can see there that it's supplying the uterus. We want to get farther out. So what I'm going to do is I'm going to pull down everything to try to give us a little bit more stability with our 5 French base catheter. You can see everything's kind of sliding down a little bit. We're going to stop there. What we'll do is we get a little bit more micro wire out into the lateral portion, and we'll follow with the microcatheter. And that may be a good spot right there in that lateral aspect of the uterine artery to do our embolization. Let's see. Yep, that looks perfect. So what we're going to do here is I'm going to collimate. We're going to go back to AP. And we're going to do our injection from here. Alright, so now our microcatheter is in a good position, and we're going to do our embolization on this side. So for this side, again, we're going to select the microspheres. We're going to use somewhere between 5 and 700. And we're going to deliver them slowly just past the cervical vaginal branch here in the uterine artery. So here you can see I'm pulsing it in. We're getting good opacification of the uterus, the fibroid uterus. I'm not seeing any reflux just yet, so we're going to keep going. And what we're trying to look for is, again, stasis or near stasis, so where it sticks around for 5 heartbeats. See how slow it's going now? We're getting very close to the end point versus stasis itself. So we're going to give it a second, just give it a little break, and then we're going to embolize again and see right there. I'm starting to get reflux, and you can see how slow this is transverse, and we see good stinning in the uterus actually. I'm going to try to just get a little bit more in without getting too greedy. And I think this is a good endpoint for us. Alright, so we'll stop there. What we're going to do though is flush out our catheter though, because there's still little particles in there. So we're going to flush this out. Alright, and now we can remove our microcatheter. You can do a final run through the base catheter if you wanted, and then unform this catheter to remove it. So what we'll do is we'll unform it right now. Over the micro, we'll pull everything back, and you can push it up actually if you wanted to remove it, or you can pull back to remove. And we're just going to pull everything out and finish. So I want to give you a close-up view of the particles that we use for this particular procedure. So for the uterine artery embolization, we're using embospheres somewhere between 5 to 700 micron, and that gives us the right size. Here you can see the small spheres that are suspended. They're like little tiny gelatin balls that are used to fill the artery there. And that gives you a good endpoint for your fibroids.